You're listening to Nonprofits Now, the podcast brought to you by Three Valleys Community Foundation. I'm Dr. Kelly Bowers, and I am your host. Joining me today is Jamie Elmasu, and she is from John Muir Health. Jamie, it's a pleasure to have you here. Thanks for joining.
Thank you, Kelly. Thanks for the invitation.
And so we're going to start off with some kind of personal questions. People want to know what's behind the scenes, kind of what makes you tick, what makes you unique and special. I know some of these things, but everyone else doesn't. So just kind of ask some questions, and we'll dive into more of the deeper subjects. So just tell me about your morning routine. How do you kick off your day? Is there some little habit that sets the tone for you?
I love that I didn't study these questions beforehand because I'm going to give you pretty honest answers.
And that's the best way.
Honestly, there's no life before coffee. So, I actually own one of those coffee cups that say that slogan, but to be honest, no life before coffee.
Okay.
My 8-year-old daughter knows that. So she leaves me alone until I have my first cup of very strong Peet's coffee.
Oh, Peet's coffee. Okay, you have a preference. And so for your inspiration, if you look back at your life, either personally or professionally, what impact has someone or something had? What inspires you or what keeps you inspired?
Yeah, I think the fact that I come from an immigrant family, it's a personal story, right? So, we're Palestinian from refugee parents, and it's the personal struggle, right? So they were able to move to the United States, decades ago. I was born in the United States in California, but I see communities that are under-resourced, communities that are either leaving, violence or leaving, really unfavorable circumstances. And my heart goes to every single one of them. So in every decision I make, every program that I run, everything I do in my personal and professional life, it's all with the community at the heart of every decision. So it's from a personal, it's a personal story, but
it translates into the professional, which makes it even more meaningful.
Absolutely. And that's why it's, for someone like myself, this is exactly why I love what I do, and I continue to be committed to doing this work in the community, is because you see the implications and the impact of what something so small or so large can do to actually change the course of somebody's life.
And that's beautiful. Thank you. So you've mentioned working with the community and caring about the community, and community means a lot of different things to different people. How do you define community? And if you could describe our community, what one word would you use?
Community, there's never, there's not one word you can use. And I think that's what really is so beautiful about community, is that it's made up of so many different parts, so many different types of people, especially in California, right? So we come from very different backgrounds. We come from different experiences, different identities, right? Yet we're all here together. We're all here at the same schools. We're all here, in the same parks. We're all here at the same hospitals, right? And the beauty of a diverse community, I think, is something that really goes beyond, any singular term, singular word. And it's really what keeps us in California, me personally and my family, and also what makes California such a beautiful place.
And I like it when you talk about people coming together, because if you actually take apart the word, and I'm kind of a word person,
yes,
community has that unity and,
of course,
and bringing together people. So what about, you mentioned a little bit about the state, but what about locally? What are kind of sources of pride in our region? What do you think makes it special? And how long have you lived here or worked here?
Yeah, so I've been living in the Bay Area most of my life, also working in the Bay Area since the beginning of my professional career. So it's been about 20 years at this point, but working at John Muir Health for 11 years. Wow. And, the Bay Area is a really special place, right? So you have such diverse ways of thinking in the Bay Area, right? So anywhere from those who are involved in, environmental activism or social justice work, anywhere in between and all around, right? And the beauty of the Bay Area is that we are leaders in the work that we're doing in any sector. So people and organizations, other countries, they look to us. They look to us to see, how are you leading? How are you creating something new, innovative, to take us to the next step moving forward? And I think that's what keeps me very excited about living here. I went to school at UC Berkeley twice.
Bears, so did I.
I know, go Bears.
I went twice as well.
See, everyone, I always say, I went to Cal twice. They're like, huh? I was like, yes, for my undergraduate and then my graduate education. And it's places like Cal, places like Berkeley, places like Oakland, the city in San Francisco, and the Tri-Valley area. I mean, we have such a diversification of geographies, diversification of people, industries, and it's solid. And I think just melding and bringing everything all together really creates such a unique opportunity for anyone who lives here.
I love how you brought that together, because especially when people think local, sometimes they just think their immediate neighborhood, but you're kind of expanding that sense of local to being the whole community. And so I know you're really busy, and I appreciate you squeezing us in. But let's say you just had an extra hour in your day and it was completely unstructured and something that you could define. What would you do? Just what would Jamie want to do?
Oh, Jamie. Okay. If Jamie had the choice to be anywhere at any moment, it's in nature. It's either hiking in a redwood forest or, on a California coastline at a beach. We love Point Reyes. I love Point Reyes. And so if you want to find me in my zen, in my element, it's really in the elements, for lack of better words. But yeah, that's where I'll be.
I can picture it now, so I have to check it out on your Facebook. Yeah. I'm sure you have photos of that. And when you look back at your younger, you're really young anyway, but looking back at even your younger self, what piece of advice would you give to that yourself? Something that maybe you've learned from or grown to know?
Yeah, it's interesting because I feel young. I'm 42, so now that everyone knows my age, I'm 42, so I am young, but not too young, right? So I've had lots of experiences. I travel regularly out of the country all the time, whenever I can, right? And I think the piece of advice I'd give my younger self is to just not strive for perfection, right? It's okay to kind of stumble along the way. And, I've learned that growing older. And now I've come to refine how I do things, right? Where I'm still stumbling, but you can't achieve anything without risk taking. And so I think especially over the course of my last, let's say, 10 years, I've been more prone to taking more risks, whether it's professionally, personally, but that's how you actually shift and change the landscape of actual work that's ultimately going to be more impactful. And I've really come to pride myself on that. And so the advice to my younger self is, just those kind of crazy, innovative, ideas that you've had, try them.
Well, that's interesting when you talk about perfectionism, because I had some of those tendencies growing up too. And then at some point, especially when you have kids and things, it's like, okay, can't really get it perfect, right?
Exactly.
You just got to do your best. But I was thinking about, we took a field trip with Three Valleys a couple weeks ago, and it was to iGate and to Daybreak Labs. And it's a very experimental entrepreneurship. Everybody there is a startup, and they are just innovating and thinking out of the box and trying to something that hasn't maybe been done before. And written on the whiteboard in someone's handwriting, it just said, perfect is the enemy of progress.
I love that.
And it was interesting.
Yeah, I love that.
And I thought, that's kind of the mantra that they're telling themselves, because they do know that, when they experiment and try things, it's not going to always work. In fact, many more times than not, it may not, but they keep trying. So that's
exactly.
exciting. Yeah.
That's interesting. You had a parallel experience to the answer of this question.
Yes,
interesting.
Exactly. So after a really long week, let's say you can't get all the way to the beaches or the redwoods, but how would you unwind or recharge?
Yeah, I think that's really where it comes to, family time, surrounding yourself with people that you love, and, just being able to just sit and, enjoy something, right? So we love the arts. My husband is a musician and an artist, right?
Oh, I didn't know that.
Oh, yes, he is. And we're always in some sort of an art scene, and just enjoying and making sure that you create like this enrichment to your life. So we're the type, we don't really stay home. we don't stay home.
You're on the go.
We're on the go. And because there's so much to experience, there's so many museums and events, we're always out doing those things. And that's how we recharge. I love to encourage my daughter, who is 8, to engage in, painting and art and creating and all of those types of things. And she embraces it. I mean, she loves it. And I see how, us limiting her, time on a screen. So we have very little time on screen, but she is a very creative, very innovative individual. And I think, because we set her up within those boundaries, she's going to be able to soar and really, really create such impact and in her own way. And so recharging is like going back to art, to creativity, to, engaging with one another at a way, like in a very personal way. And like, that's it. Have fun.
And then, so you don't even though you travel a lot, you don't have to go far away sometimes to experience those things. There's a lot of artistic things to experience right here.
Yes, but I encourage, I'm like, get out of your bubble, right?
Yeah, exactly.
Get out of your bubble. Please travel, right? Yeah.
Okay, great. So if I were to look at your passport, what would I see?
Oh, so many places. So let's see. My passport, you really want me to go through all the list?
Oh, sure.
Oh, gosh. Okay, let's see. Well, maybe I'll start from backwards. So we are going to be going to Turkey in June, so that'll be very fun and exciting. We've been to Morocco, Spain, Palestine, Jordan. We've been to Italy, France. Oh gosh, now I'm finally
Oh my goodness.
Italy, France, Greece, Mexico, the United States, all over. We've done many road trips. We've gone around even the perimeter of the United States when our daughter was just 3 months old.
Oh wow, took
advantage
amazing.
of our maternity leave,
right.
And we went camping and we explored. And I know I'm missing a couple places.
No, that's exciting. Yes, I have to live vicariously through some of those experiences because I haven't quite been as traveled. So when you look at we're going to get to the nonprofit kind of conversation, which is what we're on nonprofits now as our theme. But if you look at nonprofits, I know you get to interface with a lot in your role. Are there any particular nonprofits or individuals who you really admire and that stick out with you? I mean, and not to say that you have a favorite, but are there some that just really resonate with you that you are really aware of their really good work?
Sure. Gosh, and the answer is yes, and there's many. And so I think when I'm thinking of I see their faces in my head, right? So when you asked that question, there were a few that came up in my mind, and I think the commonality between them is their fierceness. Right, so they're strong advocates, and they're all women.
Oh,
I don't know if that is a reason for that, but they're all very fierce, strong women, and they're not afraid to push boundaries. They're not afraid to be compassionate at the same time. Right, so when I say strong, it's because they are strong in their advocacy. They're strong as individuals in terms of how they show up for the community. And they're also all able to, I see them all in my head, they're able to be there with the community on the ground, not hiding behind a computer. And then likewise, being able to, promote for, increase in financial support, right? So, promote, in terms of policy and systems change and advocacy, right? So they're there on all levels. And it's the same qualities I think I see in those individuals that I aspire to be. I try to embrace those qualifications, and it's where their heart is. Right? They're not doing it for the accolades. So you can tell.
So the passion's there, and then also the tenacity to keep.
Yes.
moving.
But it's a particular type. It's a particular character.
Now I'm starting to, my mind's picturing some of the same people I think we've crossed paths with and we share an affinity for their work as well. So it isn't just the cause, it's the people behind the cause.
Oh, absolutely. Okay. Absolutely.
That's interesting. So because you are a connector, and I know that because we've been able to connect, I feel like I've known you a lot longer even than we have known each other, kind of kindred. But what is your favorite way to connect with different individuals? And it sounds like maybe the computer might be a start, but not the end.
Yeah. I mean, obviously, yeah. I mean, human connection is, it's the basics, right? It's the basics. And so I think when it comes to the professional world, like you said, we're both connectors, and we are. I think I see that in you, and I see that in myself as well. I think it's around creating the synergy between and amongst the groups of people that you interact with. So personally, I'm all over the place. So
I have seen that.
I'm in Tri-Valley, one day. I'm in East Contra Costa the next. I'm in, West Contra Costa the next, and everywhere in between, right? And what I'm noticing especially the nonprofit landscape is that the nonprofits that are even sometimes in the same industry are not connected.
Oh, they're just not naturally.
Not naturally, because I think it's many, and I'm not saying all, but many of the nonprofits, they're so hyper focused on their specific geography, right? the Tri-Valley nonprofits really, I think, very rarely interact with any East Contra Costa County nonprofit organizations, right? And so because of the geographic distance, that's one thing, but also because nonprofits, I think what makes them so special, they're built to respond to the very localized community needs. And so when connecting, something that, we've done at John Muir Health and that I've helped lead is creating these sessions, these learner cohorts where people and organizations that we fund as grantees are coming together. And then what we're doing, we're explicitly sitting, let's say, the mental health providers in a certain area, the housing providers in another, the food providers in another.
And giving them that opportunity.
And what I learned from that experience was that they really didn't naturally know each other. Yet some actually were collaborating quite rigorously.
Right. So they can lead the way and show others
they
how
can
it's
lead
done.
the way, exactly. And I think there's a lot of power to say, we, as you know, like with funding for nonprofit organizations, it could appear as if, there's a lot of competition, right? You're going for the same or similar pots of money. There's competition. But what's innovative now, and I feel like in a lot of grant-making practices, partnerships are encouraged.
Right.
So even from the grantor, partnerships are encouraged where they're saying, okay, show us and demonstrate how you can partner with other organizations, even cross-sector, right? So whether it's with the schools, with, let's say corporations or et cetera, right? Demonstrate how you can partner because through partnership, you'll have actually longer impact, deeper impact. And I think more of an ability to sustain the efforts.
Right.
Yeah.
And more people are buying into it too. And so that's interesting because we have the power of collaboration corporate challenge, which John Muir's part of. And I think that was the whole concept. Some people thought, oh, am I going to be the only one from the banking industry? He's like, nope. We have Fremont Bank, and then we have Heritage Bank, and we have Poppy Bank, and then we also have other people in the finance. And then John Muir led the way, and then Stanford jumped in, and we're hoping others will too. But it isn't that anyone has a lock on community health, right? So the more we work together, even if out in the corporate world or whatever, there might be some friendly competition or maybe even unfriendly competition. But when we actually get to this space, it does take everyone coming together.
Absolutely.
And then the other thing is in our grants that we give out, and I know you've been part of that process, is we give extra points for collaboration and even extra funding to encourage the collaboration.
Oh, absolutely.
And not for collaboration's sake only, but what we found is once you just give a little bit of incentive or you reward people who are naturally doing it, then that grows more collaborative spirit.
Oh, absolutely. Absolutely. And what I'm seeing too, like as a trend now in some of the direct service nonprofit organizations, where let's say one organization, has a brick and mortar in a particular geography, then they're partnering with other organizations that are supporting, but saying, okay, we have an office space for your case manager, for example, right? So then another organization is coming in with the case manager, providing really those linkages between the services that one organization provides and the other. And it's really beautiful.
Amazing.
It's really beautiful. And I'm seeing that come up more and more, especially in the East Contra Costa County, as well as the Tri-Valley area. Because I think the nonprofit landscape is not as robust as some places, let's say in Alameda County. And so I think when there are less providers, you have to. You're forced into working together, but not in a negative way, right? You're forced into actually being very innovative and creative in terms of how to make sure that the needs of the community are met.
You can't do it alone, and so you recognize that, and you're more compelled to.
Exactly.
Yeah, I like that. So you definitely are a community connector. I think that fits. So we're going to get a little bit into John Muir. I know you work with John Muir, and they have a mission and they have their values that are established. And how does that fit into the nonprofit world, into your community outreach, and then also into your work with Three Valleys?
Yes.
Your partnership.
That's great, Kelly. Yeah. And John Muir Health is really a special health system. I mean, we are a community-based health system, and we're a nonprofit health system.
And not everybody understands that.
No.
So can you just explain a little bit about how that works?
Yeah. So, actually, I feel like most of the hospitals and health systems that, the Bay Area folks interact with are actually nonprofit health systems. And in order to be a nonprofit health system, the health systems have to reinvest in the community through community benefit. And so if the listeners out there are not aware of what community benefit is, it's actually quite powerful because the health systems, they have the backing and they're actually required by the IRS. So it is an IRS requirement, but to reinvest financially. So financial dollars, philanthropic dollars into the communities. And so when we define the community, right, for community benefit, it's defined in a different way. So for John Muir Health, it's defined by being outside of the patients, right? So the community is anyone who is considered vulnerable, right? So these are our lowest income, low resource communities, are people who are uninsured, new immigrant populations, and it really ranges, but it's really to address the need of the vulnerable. And you do not have to be a patient of John Muir Health for community benefit to impact you. And so my work is always outside of the walls of the health system.
Oh, that's really interesting.
So it's a very external facing position. And so for each of these health systems that file as nonprofit, they are able to embrace community benefit in their own individual ways. And I think John Muir Health actually does a phenomenal job because not only do we give out grants, so we have a large grant making portfolio. So we give out grants based on identified health needs. So every 3 years we go through a process, and it's a community-driven process. So
is that assessment?
It is. And so you'll be happy to hear that our 2025 Community Health Needs Assessment will be released by the end of the year.
Oh, okay.
Yes.
Yeah, because that's how I do my homework. I do my research.
Exactly. And so we encourage, anyone really to read this report. It has robust data, and it's separated by geographical region. So the Tri-Valley has, their own region and their own prioritized needs, as well as the other regions that the health system serves. And so what we do, so we take back that information to the health system and we say, okay, how are we now going to develop programming, grant-making strategies, and strategies that align with actually the health system's strategies? And we come together, we create a proposal, and we actually go out and seek out these specific partnerships. And so, if you have seen our mobile health clinic on the road, that's a community benefit program. If you've heard of our, Beyond Violence, violence intervention, hospital-based intervention program, that's a community benefit program. And so we have about 35 programs out in the community.
35. I didn't realize. So I've heard of a few. I haven't heard of all 35.
Exactly.
So that's amazing, though.
Yeah.
And so it's beyond the walls of what you already offer, which is health care for all your patients.
Absolutely.
So, wow.
Yes. Yeah. So community benefit, it's fun because it keeps me on my toes. It keeps me creative. So I'm a very naturally creative individual, and being able to work with nonprofit partners and design program-oriented solutions to meet the needs of the community. That's really what makes me, drives me and keeps me going, and being able to figure out, okay, our Beyond, for example, our Beyond Violence program used to be, have one community partner, and it was a smaller scale program, youth-based program. And, it started in 2010. Since 2010, we've been able to expand it to now serving anyone over the age of 14 who's been violently injured. In Contra Costa County, John Muir Health is the trauma center for the entire county. And so we receive people from all over the place. So whether you have been stabbed or shot or experienced assault, and they come to our trauma center. And so what happens is our social workers intervene. They are able to be at bedside with the patient, their families, and then refer. So based on eligibility criteria, but now the eligibility criteria has been expanded quite drastically, especially in terms of age and geography. But they're able to refer to this really robust network of nonprofit organizations that provide linkages to, let's say, financial assistance, employment, victims of crime compensation, mental health support. Mm-hmm. And we are doing this program, I think, so well. So not so well, I'm not trying to brag about the program, but just
well, you're making an impact and people are taking notice and you're seeing and it's measurable results.
It's the partnerships, right? Mm-hmm. So it's we have our trauma center, our social services, our community health improvement team, right? So we have the John Muir Health Foundation. So we have 5 departments from within John Muir Health, plus 5 nonprofit organizations that we're partnering with. So Family Justice Center, Fred Finch Youth and Family Services, Center for Human Development, Rise Youth Center, and One Day at a Time.
And those off the top of your head,
of course,
because you're working hand in hand with them.
Yeah. Absolutely, and we work hand in hand. And by listening to the collaborative, it's our Beyond Violence collaborative, we've been able to add services, and that's how the whole mental health component was added several years ago. And so when we fund the program, we're funding not only just the operations of the program, but also direct services. So we're funding mental health therapists to provide services not only to the person who survived the violent crime, but also their families, their loved ones, their close contacts.
Right, because everyone's affected
Yep,
by it.
yep.
And so you mentioned mental health, and I think that's how you and I kind of got together the first time, is it Three Valleys used the assessments that you and the other hospitals came up with. And what we saw was there were different trends, but the one that really was glaring across all demographics was the mental health challenges, behavioral health challenges. And that was something that we thought we could begin to be part of the solution. Obviously, it's not going to be resolved in one year of grant funding, but that's how we first met. So tell me a little bit about what inspired you to take a more active role in our collaborative.
Yeah, I think mental health is it, because one thing that really traverses across, socioeconomic status, right, race, ethnicity, abilities, disabilities is mental health, and I see it really glaring in our communities, especially with our young people, and we're not doing enough to support our community. Just in general, as a community, we're not doing enough to support the mental well-being of the entire community. And I think we need to start to utilize more innovative approaches to really get at the heart of what is actually happening, right? And so, I'm a big proponent of, earlier intervention. Right. I'm a big proponent of making sure that families feel supported. We have to figure out ways to minimize stress, because a lot of this comes from stress.
Minimize it, and also coping skills for stress.
Coping skills, absolutely. And working with the young people, right? Not just our teens, but get even younger, right? So younger. So when we're thinking about those mindfulness interventions at, let's say, kindergartens and elementary schools, that is mental health, right? So teaching those skill sets to young people that they can then utilize throughout the rest of their lives, I think is absolutely critical. And then on the flip side, it's around supporting our adults who weren't raised to understand what those coping skills look like, and figuring out how do we support our adults in these innovative ways. And our adults, right? So when we say adults, it's so many different types of adults encountering so many different barriers and stressors in their own individual lives, right? And so when we're talking about, let's say, a new immigrant population where English might not be their first language, how do we create programs in the community for that specific population? And what I love is, we help support, and we've supported it for 10 years now with Monument Impact. It's a promotora program, mental health promotora program. And those programs, those community-driven, community-based programs, they work. Right. So
there's trust, there's relationship, there's connection, and it's customized.
Absolutely, it's customized. It's in the language of the community. It's being the curriculum is being given by the community as well. And so the results from programs like that, stress is reduced, depression reduced, right? Anxiety reduced, and then on the side effects is weight loss, right? Increased physical activity. So if you think about that,
it's all connected.
It's all connected. And so when it comes to the young people, our high school base, and I think this is what Three Valleys is doing a really phenomenal job at, is engaging in the schools, the local schools, especially with our teens.
Maybe it's a little bit because of my background. I don't know.
100% is because of your background, but also because you're at such a critical place where you're recognizing, you see the need at that age. And, going back to the data for Tri-Valley does show behavioral health needs are the highest in that age range, specifically in this geography. And so when it comes to interventions, it's okay, so it's education, right? I know there's plenty of interventions, right? So we're funding several different types of interventions, but all of them are different.
Right. We have the wellness centers. We have things like Alan Hu Foundation, and we have Z Cares, and they're doing film or webinars, and sometimes there's cultural sensitivities around acknowledging mental health challenges or stigma, and so they're addressing it in a lot of variety of different ways, as well as in kind of more traditional. Do you think that the pandemic just revealed it or exacerbated it, and do you think that because the pandemic's a little bit in the rearview mirror, it's going to disappear, or is it just going to manifest differently? What are your thoughts on that?
I think it's much more than the pandemic. I mean, it's the political environment at this time. It's the pandemic. It's also, this lack of resources, right? Our population continues to grow. What we're seeing is more people becoming unhoused, more people becoming food insecure.
The haves and the have-nots.
Yes, yes. And even for those who, quote unquote have, right? I know this is the big issue in the Tri-Valley area is, let's say your child wants to get accepted into a college, a great university, a UC. The chances now are they're becoming slimmer and slimmer. And so the stress on the children, on the young people, is creating this just
almost unrealistic expectation.
Oh, yes.
And really agonizing for them.
It is agonizing. And it's like, okay, so how do we create systems? And this is the thing. So it's we have to redesign our systems because there's no direct route, right, for every single person. So how do we create industries and systems where people feel like they do belong, they fit, they can utilize the skill sets, their interests, and actually create like the very robust, let's say, careers, maybe not going directly to a UC.
Their own path.
Their own pathways. And I know the school systems are doing a lot of work around, workforce development. John Muir Health is investing heavily right now in workforce development. But figuring out new ways to accomplish what it is that our society needs in the future. I mean, what we're doing now is not working. And I think we all need to come together and figure it out.
But there are pockets of success. And I know we had the good fortune with Three Valleys. We were able to visit your behavioral health center. And I think that was a really specialty niche for the very young children. And it's kind of, my understanding is that everybody doesn't offer that. And we were, it's sad to even think that, second graders are feeling this way. But the fact that they are despondent or feeling a certain way, that someone's going to do something about it so that they're not going to be in their 20s feeling that way. Tell me a little bit about that, because I know some of it's behind closed doors and it's clinical, but what is unique about it?
Yeah, so John Muir Health, we do have a behavioral health center, which offers psychiatric services for children, as well as adults, of course. And I'm not the expert in our behavioral health services, but
is it Jessie? Yes. Jessie Templin.
Yeah, so my colleague Jessie Templin is absolutely wonderful and a wonderful advocate for these services. And what's so unique about the services is that we are able to provide and meet a need for the children, the pediatric population. And I think he knows the statistics off the top of his head. I do not, but it's really like eye-opening in terms of when you hear about these statistics, when it's young people, really young, as young as the age of 8 and 10, really encountering these very severe issues when it comes to their mental health. We have to do better as a community. We have to do better to support them. We have to do better in terms of making sure that they don't get to our behavioral health center. And I think that's really where public health, so I have a public health training, and that's where public health really comes to play, is that we have to focus in on prevention and creating safe communities, creating places where people can connect. So going back to the connection, that's what creates resiliency, is connection. And when you're resilient as an individual and as a community, you will have better mental health outcomes and better physical health outcomes as well.
So when those challenges come, you can bounce back from them and you can regroup and move forward.
Right. And so I think when it comes to like collaborating, right, the Three Valleys Community Foundation and John Muir Health, figuring out in terms of our grant making strategy, it's the prevention aspect, right? So how are we creating these resilient communities where people are more connected? People feel like, they're able to contribute, because that's one sense where you feel valued, you're able to contribute, you feel like you belong. All of that, it all goes back to mental health. It all goes back to feeling, how you feel as an individual and how you feel like you fit in the grander scheme of society. And right now there could be so many reasons why someone is feeling down. There could be so many reasons, whether it's in their, initial immediate family unit or whether it's a larger societal issue. And, it's community building, it's connection, going back to connection, figuring out how do we create those opportunities.
Well, and even though we started just asking some personal questions just to get to know you better, when you started, you were talking about how you recharge, and some of those things actually, whether it's nature, some of those things do help benefit not just physical health, but also mental health. And so some of those things you're actually bringing to play. And it is interesting, young starting with mindfulness and things like that is teaching young people how to center themselves and how to think through things and not just respond or have outbursts or be impulsive and things like that. All that leads into kind of a healthier growing up.
Yeah, absolutely. And you're making me think of there's several organizations now that are embracing nature-based interventions.
Oh, okay.
So this has been a dream of mine, is to like create, grant making around nature-based interventions.
Oh, I love that.
But there's several. I mean, and what they're doing is they're teaching young people how to access natural areas just around them in their backyards, right? We live right at the base, right, of Mount Diablo. We live where there's so many natural preserve areas that so many people don't know that it's literally, in
your backyard.
In your literally in your backyard. Exactly. And they don't know. And so it's around teaching people how to access those like peaceful areas, how to engage in nature where it's not, it's not off-putting, or you don't have to be camping for 3 nights, even though I love to camp for 3 nights, whatever. But, it's those types of interventions that are mental health interventions, in my opinion, that will actually help teach how to recharge, teach the skills that young people need, where it's off a device, they're disconnected, they're connecting with nature and connecting with others.
And I was able to go to a community garden, and I saw that in action kind of. And also what was neat was the intergenerational approach to that. So and one of the dads actually said, I've never physically had a gardener or something, and he'd never physically labored side by side and sweated with his son, and it came with all of these other benefits too. And it was kind of it was kind of a neat thing to watch and to capture and to see. It was just about an hour away, or maybe it was, and then they do it for Make a Difference Day. They just go out and do something like that, and it builds community, but it also has a tangible effect, and then it has this internal benefit.
Right? So. There's something about putting your hands in the dirt, right?
No, I love
There's
that.
something about it, and it really creates this sense of stability.
So in our world right now, there's a lot of emphasis on, data and measurement, especially when you give grants, and so how do you measure, and what kind of metrics are you looking for? Is it always a number, or is it just one number? I mean, if one life is saved, is that sufficient? And is it qualitative? What are you looking for? Or maybe it's not a one size fits all.
It's definitely not one size fits all. And you asked me a data question, so Kelly, I'm a data nerd.
Oh, there you go. Okay.
And so I actually started my career before public health was in neurosciences.
Oh, okay.
And so definitely very data driven. And so when I switched gears and I actually went to public health, my first few jobs were in program evaluation. And so, I mean, you're asking me this question. I didn't know this question was going to come up.
It just came to my mind.
This is great. So it's interesting because when you're measuring the impact of a program or of a grant making strategy, you have to be fluid. You have to be nimble. Yes, you can measure, you can count, you can count number of people served. Okay, fantastic. But that doesn't tell the whole story, right? So you have to figure out, so it's very program specific. You can say, okay, we can check the box in terms of quantitative metrics. How many people were provided with food? How many people engaged in mental health therapy services? How many people, you
kind
can
of how
do
many
that.
people attended or participated.
You can do that, but that's not going to tell you what you really want to know. So it's really important to really tease out those qualitative experiences. And you do that by visiting the programs, right? Going on site visits. You do that by speaking with the clients or the members.
I'm getting so excited because that's the kind of evaluation I love, is the interactive and you're actually firsthand experiencing it.
And it is firsthand experience because sometimes, let's say a program let's say they're impacting 20 families. 20, sometimes people might say, oh, that's not enough, right? That's not enough. But when you think of, let's say, let me put a type of program like a diabetes education class, right? So someone with type 2 diabetes goes to a class, is educated upon, how to change their dietary, the food that they eat, how to change, their exercise, right? When that person changes, the family changes, right? So
future generations.
Change, right? And so what I always find fascinating and the biggest challenge in program evaluation is how to measure the vibration.
Oh, I love that. I'm going to write that one down.
Yes, that's what I find. And that's what kind of gets me back to my geeky self, right? Is how do you measure the vibration? So this is one of the things that we've been trying to work on right now is, okay, so we've hired a mental health therapist to be at a under-resourced school, like a high school. So that mental health therapist, is providing direct services, direct therapy for free to the students of the school. But we know that just the essence, just the person, but by fact that the person is just there at the school is impacting the well-being of the entire school.
Because it's a calmness and a reassurance, and there's not that
And
worry.
the fact that there's a presence, right? So there's a presence of this person, not just that I have a calm presence or anything like that, but the fact that a service is available at the school.
Right. So there's not that added stress of I'd have to go to be
Yes.
referrals or something like that.
Right. And let's say, you're passing this person in the hallway, right? You're whatever, but there's some sort of an interaction. Right. And then if you know that your friends and your classmates are getting assistance from this person, what impact does that have on you? Right?
Oh, I hadn't thought of it that way.
So you think about it like that, and then you think also about the
so it's
parents.
a little more indirect benefit.
It's indirect.
Okay.
It's indirect, and that's when it comes to like the vibrations of program impact. That's what you're talking about. You're talking about now, a high school student is getting this therapy. What are the effects on the sibling? Right. There are effects, absolutely positive effects. What are the effects on the parents, right? The family unit, et cetera, et cetera.
So you call it vibration, I call it ripple effect, but it's the same thing.
Same thing.
There's all those things happen. And I've always tried to surface that, and some people sort of discount it. So you're giving me some of the tools, the neuroscience tools to address it.
Whether it's neuroscience or just simply like, connection, right, too, because if you look at, you just made me come up with a visual in my brain, but right? So when your neurons are interacting with each other, right, it's this huge network. Right?
Firing off.
Everything is firing. Similarly, right, with community work.
Oh, I like that.
Think of it. It's the same. Yeah. It's the same mapping. It's the same thing, right? And so when it comes to evaluating that, what does that look like? Can we measure connection? Mm-hmm. Possibly. Mm-hmm. Can we measure the impact of connection? Yes. So I think we have to get there as evaluators, and just not stick to just the quantitative, just the volume. Mm-hmm. It's important, great, but I think it doesn't tell the whole story for sure.
Well, now my mind's going, so that's good that you got me thinking about that. And so when we look ahead, mm-hmm. and so you have so many things going, but what would be next? What are your goals for next year? It sounds like you've been there 10 or 11 years.
Yeah, 11.
And it's always changing. The landscape's always changing, and it seems like you're pretty adept at pivoting and embracing new things. But if you could kind of drive that ship and chart your course, what would be next? Is it coming from that assessment to determine, or is there just a passion thing that's left unsaid? Maybe it's starting that nature.
I know.
I don't know.
So for practically speaking, right? So we are in our needs assessment year. So practically speaking, our 3-year grant cycle will be opening up in October for our funding for the next 3 years. Okay. So practically speaking, my work is really, it's cut out. Yeah, And
you're taking that through focus groups, through... So, yes. Where did you... I kind of know, but I'm not sure if everyone knows.
No, that's great. Thanks for the question, Kelly. So when it comes to the needs assessment, we actually collaborate with the other health systems in the area. So we hire consultants. The consultants and our public health department. So we worked with both the Alameda County Public Health Department as well as Contra Costa County Public Health Department. So thank you. Shout out to them. But we've conducted robust focus groups. So with various communities, various ages, various identifications. And so robust focus groups, also robust key informant interviews. And so this is with stakeholders all across the entire region. So almost the entire Bay Area, to be honest, when we're looking at all the hospitals. And all of that information feeds into the analysis, plus quantitative data. So you're looking at the county's data, you're looking at the public health department's data, and all of that feeds into identifying, okay, those priority needs. And then the community is asked, if you were to prioritize these 12 needs, what order would you place them in?
Okay.
Okay. And so then that information then gets taken back to the health systems. The health systems then decide individually what they would like to focus on for community benefit.
Okay. So you might focus slightly differently than
we may.
Okay.
But what in my history, so now this is, I believe, how many times? This is going to be the 4th needs assessment that I've participated in. And
because it's every 3 years.
Yes, every 3 years. The first one was back in, I believe we published 2014. Oh my, 2013. Yeah, the implementation in 2014. That's correct. So yeah, so it turns out that the health systems, there's always some sort of overlap. And so in our service area, what we try to do is work with the other health systems. So maybe there is a program or an organization that we wanted to actually partner on, collaborate with, and say, okay, if you fund this portion, we'll fund that portion, and we'll actually create more robust support as it comes to making sure that the program is able to offer
So
the
kind
services.
of divide and conquer, but you're still working toward the same solutions.
Same solutions. Like, let's say, one health organization supports, a wellness room. The other one supports, the mental health therapy. The other one supports, a train the trainer program, right? But ultimately, all of them are feeding into the same issue.
Oh, that makes sense. And so from the focus group, you'll be getting all this information. Then you have the informed people. Who are those?
Yeah, the key informant.
The key informants. Okay,
yes.
Sounds a little bit like a little bit of FBI there. And so those are people who really know what's going on, and they have their fingers on the pulse plus the knowledge base, I guess. So then all that comes together. And I remember reading. I read it, and I pull from that for what we're going to focus on with Three Valleys for our piece of the pie of the grant making. But I know that one surfaced, it was in Dublin, and it was it had to do with commuting and transportation. And I had not thought of that in terms of health, except I had thought a little bit about maybe environmental health, but I just also the toll on people and the connection with their families and the stress and all those things. And so I didn't realize how, for some reason, the Dublin population was having tremendous long commutes comparatively to others. And I just thought that was interesting. And so, but that surfaced from there. So I learned from it. I'm looking forward to it. So I did my homework.
No, that's great. And transportation continues to be an issue specifically in Tri-Valley, by the way. It continues to be an issue. And when it comes to healthcare access, think about that, right? So it's like, if you can't get to your doctor's appointments, and I know that telehealth is very popular now, but not everyone is able to do telehealth.
And not every type of health challenge lends itself to that. And I know that was a big challenge with the vaccination clinics and things. And that's one of the things I got involved with the school district, was bringing them even closer than the Coliseum, even closer than the fairgrounds, because we needed to have it literally in your backyard where you could walk across the street or, take your bicycle on your 10-minute break from your service job just to get to it.
Absolutely. And that's why we have the mobile health clinic program, is because we're bringing services to the community.
Yeah. Well, mobile health seems to, now they have mobile dental health.
Yes, we do. Yes.
Yeah. When I saw that, I learned a long time ago from the school nurses that dental health is one of the largest predictors of overall health. And I think it was dental and eye health were the two biggest barriers for young kids to access education. And I had not made that connection, but they miss more school and they're in pain and they, whatever it is, or they can't read, the board or whatever it is. Those were things that if you don't have those, that some people might take for granted.
Yes.
If you don't have them, then other barriers go into place.
Absolutely. Yeah. And that's why we support a mobile dental clinic program.
I love that.
Yeah. It's a wonderful collaboration, and it's been going on since now 2003.
Wow.
So, almost 20 years.
Well, you have just shared so much. But anything else looking ahead? You said that so the needs assessment is going to come out. And then what next?
Yeah. So what next? So we're going to have, a grant making portfolio. We're going to have a strategy, hopefully. I think what we're going to be leaning towards is a lot more work with workforce development.
Okay.
So, be on the lookout for that, what that might look like, what shape it takes, et cetera. But it's a huge need. And so I think I was mentioning earlier in the conversation that, we have to figure out different modalities and making sure that, young people feel like their skill sets could be used, figure out, how to utilize their creativity in ways that are productive. So, there's a huge
pathways
need
for success.
Yeah, there's a huge need, and there's a huge need, especially in healthcare, for various types of positions, right? So not just going the traditional route of, different types of physicians or nurses, but so many different types of positions in tech and radiology, et cetera, et cetera.
So can I share just a little brief? I was working with young people a few years back, and they were talking about career, and instead of saying what job do you want to have when you grow up, we would say what problem do you want to solve,
that's
and you get
interesting.
kind of a different answer, right? Because if you say what job, they just rock star, baseball player, doctor, lawyer, teacher. They come up with just whatever they've been exposed to or whatever they hear. But when you say what problem do you want to solve, then kids start to think and say, oh, I wish this would be fixed or whatever. But one of the things we did, and it was related to healthcare, and I used to teach drama too. So what we did is we brought all of the young people together, and instead of just saying, and we picked an industry, we picked healthcare, and the students in the drama class role played. And so to try to teach everyone in the auditorium the whole gamut of jobs that were related, right? So for instance, even your job, you wouldn't always say that that's in healthcare because it translates into other industries as well. And so what they started with, and we had the idea, kind of the inspiration we co-created, but they took it further. Of course, young people always just take everything farther and do it better. So they started off with someone said, I just have an emergency. So they said, I'm going to call 911. And then another student said, 911, what's your emergency? And then we said dispatcher, and then said what the salary was and what the training was.
That's interesting.
And then they said, okay, paramedics will be on their way. And they said, I'm a paramedic, I'm the responding fire, whatever. Then they get there, it's like, I'm the triage, I'm the intake, I'm the translator, I am the person who does whatever, and then, they went, and I'm the x-ray technician, whatever was needed, and the kids would add, and by the end, the person was like a mess, And then they finally, after like 12 or 15 jobs, they got to someone who was a doctor because they'd had so much. But the first thing, when they first came in, they took a little survey and said, if you think of healthcare, what jobs? Doctor, nurse. Some said surgeon. That was it.
Yeah.
And now they've already seen 15 careers before they even got to the doctor. And then there was anesthesiologist and all these other jobs. Did I say it right? I think I did.
That's good.
And so they kept going, and then by the end, there was a social worker, there was this and that, and they had covered probably 50 careers. Wow. And then there were even the people that came in, cleaned the bedpans and made the beds or whatever. And so they said, in that gamut, if you want to be in healthcare, you could have any of those jobs based on your desires, your skills, and how long you want to go to school and what your salary range would be. Right. And it was so much fun. And so I thought about that a lot when I'm thinking about career development and workforce development. We used to say cradle to career. Like you start young with exposure and kind of let the young people know what's out there, but then you give them real pathways, and sometimes they learn what they don't like, which is even better.
That's so valuable, and we do that with our Young Healers program. So that's one of our high school based.
Which Young Healers?
Young Healers. Okay. So this is in partnership with Junior Achievement of Northern California, but we started the program at John Muir Health, and it's such a unique program because, well, we have, let's say, about 30 slots each internship cycle, so it's very competitive, and we do open it up to, all the schools, especially in Contra Costa, and now we're going to be opening up with Pleasanton Unified and San Ramon.
Oh, wonderful.
Yeah, so really a lot of school districts, but those students that are able to get in, what we do is we match them with a department. And so they come in saying the typical, right? I want to be a surgeon. They're very specific. I want to be a, neuro something, they go on with, it's very specific type of. Based on
whatever they've heard or experienced.
Yeah, but very specific. And it's really sweet. But they come in and we expose them. So we match them with a department. And the idea is that they're actually going to be exposed to a variety of careers within that department. So they'll see, just like you were explaining, the different types of careers, the different options, how many different roles there are. And we're not even talking about the administrative roles, right?
So there's a whole nother... because you have accounting and human resource. All organizations have those types of things.
Yes, the administrative roles, a role like myself, I have a public health background. I'm in grant making, and so many students have, they wanted to switch to public health. I don't know if it was because of me. I don't want to take so much credit, but anyways, and I forgot my train of thought, but the point is
the Young Healers.
No, the Young Healers program. Yes. So the point is, when we introduce the program, I like to ask this question where it's like, what do you aspire to be, right?
Right.
So what do you aspire?
And now that gets them thinking.
But you think, but then not just what do you aspire, but what inspires you?
Oh,
right.
Okay.
Because those two words are so similar, and if they can identify what inspires them, it'll be a lot easier to answer the question of what they aspire to be.
Right, because that's their passion that's connecting them.
Yes.
Okay. So we started off that conversation with Inspire, and
that's
we ended
true.
with it.
Look
So
at
that's
that.
good.
Full circle.
Well, and as I kind of sum it all up, I heard a lot of community, a lot of collaboration, and probably the strong and a lot about inspiration, but really connection seemed to me. If I could sum up everything that you talked about, it's what you do naturally. It's probably why we feel connected. I think anyone listening is going to automatically feel connected. And so how do we stay connected with you or with John Muir, or what would nonprofits that want to be connected with you, you know, what would they do? What would their next step be?
Oh my gosh. Well, okay, from the professional sense, you know, you can email me, of course. So we have a community benefit email. So this is public facing. So community.benefit@johnmuirhealth.com. Okay. So feel free to reach out if there's inquiries around the grant making strategy, or we also offer sponsorships. So if there's galas or community fundraisers, things like that, we do offer sponsorships to nonprofit organizations. And, you know, we've supported, you know, we support typically around 100 organizations each year.
That's amazing.
Through sponsorships. The grant making, the 3-year grant making is a little more limited. So that's around 30 to 35 organizations for those 3-year grant cycles. Right. But there is always an opportunity to connect. Right. Always.
I love that. Yeah. Well, thank you, Jamie. Is there anything left unsaid that you just want to add? Or
thank you, Kelly. It's so fun. It was fun.
I like that. I'm glad you liked it. I had fun too. Thanks.